Janis.
Okay, thank you very much. Again, I'm delighted to be here and to take a crack at summing up what has been a really intriguing and very complex set of presentations that we've had. Speaking to my part of the elephant, which has to do with anthropological studies of mental health. I said during my talk yesterday that we have now decades of empirical research that show the central place of culture in nearly every aspect of mental illness, whether we're talking about onset and or course and outcome, et cetera. And yet the model, the working model that we have been thinking about during the course of our time together, the ecological model of risk and protective factors, I think could be enhanced by integrating culture across the different sectors of the individual, the relationships, the community and society. And that's at the conceptual level. And I did make the statements that I think to do that, we really will need a broader and deeper understanding of culture across the board. For research, I think we will continue to need ethnographic work with persons and their own experience with mental illness and with encounters in relation to violence as victims and also as perpetrators from persons' own experience. I also think we need, there's a quite urgent need globally to work with adolescents and to understand more about, from their perspective, frustration, anger, and violence, and their views of the cultural legitimacy or illegitimacy of that. Because this is changing over time and across places, and I think we need to know more about that. I also was impressed with my colleague to the left of me, his research and talk that we really need, if we could get it done, ethnographic research on the culture of law enforcement and cultural assumptions to include fear, as you just mentioned, toward the goal of more effective reciprocal engagement. In terms of programs, for effective community treatment and intervention programs, we need to take into account cultural aspects of the interrelations among mental illness, emotion, and violence, because I do think, as I've indicated, that these are really quite inseparable. I think we also need to look at the limitations of treatment as it is standardly offered in this country and also even globally when it's reduced to psychopharmacology, and I consider that to be a significant challenge for us. In terms of implications for policy, I think that there's a need for national, state, and community officials to be informed of the specific aspects of radical curtailment of mental health services. And here I really have in mind the recent research that I and colleagues have done in New Mexico with adolescents hospitalized there, and what has happened over the course of time with, again, such radical curtailment of services and terrible consequences of that. I think we also need to consider interventions in school settings to learn from and teach children and adolescents about what constitutes a culture of violence, and to get consciousness about this and critical thought about that, and specific strategies to both critique and disengage from these as desired. And final couple of points, we need the provision of evidence-based data on the reality of improvement of persons who have had conditions of mental illness, and the need for designing strategies, treatment places from their perspectives as experts in the area. So I'm very impressed with persons who are speaking from their own experience of having had mental illness and figuring out strategies and communities and grassroots efforts to improve that. And finally, I think that we really need to, this has already been mentioned, but we really need to engage and to challenge notions that constitute a kind of culture of scarcity among policymakers in this country and indeed globally, insofar as that's accepted kind of thinking, and to not accept it and to work to get away from that. The culture of scarcity and the acceptability of that is just about as violent as the culture of violence that so many of us are concerned with finding ways to counter as well. And with that, I think I'm done.
Thanks, Janis. And just to clarify, I think by the culture of scarcity, you mean we just don't have enough resources to provide the type of mental health services and care and attention that we ought to.
That is what I mean, that the culture of scarcity this is the culture of policymakers who speak in terms of and think in terms of there's only so much we can do, and in my view, ready acceptance of those limitations.
Okay, thanks.